I think you need 5. 1, 2, 3, 4, 5. I think 5 is a quorum.
Yeah, 5 is a quorum. You guys have a quorum now.
Quorum. So let's start. Oh, Liz, thank you for apologizing. There's a couple people late, but thanks for joining us. All right, so Joe and I emailed back and forth this week, so he's going to be a little bit late. So I am going to chair the meeting until he gets here. He has a meeting that he believes will go over, and so I am going to chair till he gets here, and then I will turn it over to our illustrious chair, Joe Everett. So the meeting agenda is as such. We will approve the minutes of February and March. Then we will have a discussion on detox beds and some next steps. Then we were going to discuss the council priorities, but after speaking with Mary, she's going to wait on that for the next meeting and be able to better report on that at that next meeting. Then we're going to do, if possible, I don't want to put you on the spot, Brendan, a quick update on the current projects and contracts. And I'm hoping that that part takes about 45 minutes to an hour, and then we're able to spend the second hour on a proposal or a conversation about application that Courtney Allen Gray has brought before the committee. So that's sort of the way, the flow of the meeting, if that works for everybody. And I see Brendan has his hand up.
Yeah, just to say that partway through the meeting at around 4 o'clock, I will need to switch to phone. So I'll drop off the video and I'll be available, only by phone.
Okay, great. Right. So let's start out again, as we always do, with a welcome, because we know that we have people that join us. I see that I'm going to kick out of this 24 participants. So there's always somebody listening in and paying attention to the work we do, which is good. So I'm just going to go around and ask people to introduce themselves. My name is Pat Kimball. I'm the chair of the Recovery Council. And today, just sitting in for Joe Everett until he gets here, who chairs this meeting. Ella, I'm just going to pick my squares here.
Hi, I'm Ella. I'm with the AG's office, so not a member of the council.
Thank you. Haley.
Haley Tranko, also with the AG's office, also not a council member.
Thank you. Brendan.
Brendan O'Neill with the AG's office as well.
Thank you.
Not
Gordon.
a council member.
Gordon Smith, I'm the state's director of opioid response. I am one of the members of the council and this committee.
Thank you. Mary.
Hello, I'm Mary Coyne, and I'm the coordinator for the Maine Recovery Council. Also not a member.
Thank you. Liz.
Hi, Liz Weckelmore, a Director of Public Health for Cumberland County Public Health Department.
Thank you. Kina.
Hey, Kina Thakkar, infectious disease addiction medicine doc in Portland, Maine, and I'm at the hospital today, so I might be in and out.
Okay, well, we certainly understand that. Chastity.
Hey everyone, Chastity Toole, the Northern Maine Director of Harm Reduction Services at Maine Access Points.
And Courtney.
Hello, everybody. My name is Courtney Gary Allen, and I am a person with living experience of substance use and a member of the council. I'm in transition. I'll be on camera in just a minute.
Okay. All right. And Miles, just introduce yourself quickly. Thank you for joining us.
Yes, hi, I'm Miles Willett, a clinician with an outpatient treatment facility here in Maine, and someone with lived experience. Thank you.
All right. Thank you very much. All right. First order of business is to review the minutes. If we can do them together, that will save us time for February 20th and March 5th. I don't know if you have any discussion. If not, can I hear a motion?
I make a motion to approve the minutes for March 5.
Can you add February 20th in there? So we do it both at once?
Got it. I make a motion to approve the minutes for February 20th and March 5th.
Thank you.
I second the motion.
And Gordon seconds it. Any further discussion on it? If not, Haley, can you please call a roll?
Yep. Liz Blackwell Moore,
Yes.
Todd Brackett, not here. Joe Everett, not here. Pat Kimball,
Yes.
Bruce Nodden, oh. Miles Olet,
Yes.
Gordon Smith,
Yes.
Kina Thakrar,
Yes.
Chastity Toole,
Yes.
that's 6 carries.
All right, motion carries. Thank you very much. Okay, the next item on the agenda is that we wanted to talk a little bit about, we keep putting it off at every meeting, the detox bed and sort of determining the next steps. And when I talked to Joe Gordon, I don't want to put you on the spot, but he said you had some ideas as to how we could get that moving forward.
Well, Joe had asked me, following my report on the state's experience in Washington County, to check on Franklin County and Androscoggin County to see what the prospects were if we were to effectuate the vote in December, wherein we committed $1.5 million, I recall, to for 10 detox beds in Franklin County, and another same amount in Androscoggin County. Those votes were unanimous, as I recall.
Mhm.
I think at that time we recognized that, those would require significant drafting of RFPs and would take, I think we understood that of the projects that we voted in December, these would come last because they'd be the most difficult.
Yeah.
And the most difficult to implement. I think some of you heard this story about our experience with the state money in Washington County. We put together through the legislature, had appropriated money for a project in Washington County and in Kennebec County. The legislature had cut that back to just one county, and then the state found enough money to do both projects. The projects were somewhat different. It was just freestanding detox, 10 beds, up to $150,000 a bed in Washington County, hence $1.5 million. And the project in Kennebec County was more an SUD receiving center with lots of different bells and whistles associated with it. I'm not going to talk today about Kennebec County because there's still work being done on that. But in Washington County, I can be a little more explicit because no one applied. And there was a informational session, and people and organizations appeared at the informational session, asked questions. Those were all answered. But when the time came to receive applications, there were no applications. So that allowed OBH staff and myself to talk to people in Washington County who had been at the listening session at the informational session, for instance, to say, gee, you were interested enough to come to the informational session, but you didn't submit an application. What is there about this application that made this a non-starter for you? Because we really think we need the beds in this part of the state. And we got, very thoughtful responses, one type or another. But it did certainly cause us to take a step back, frankly, and say, gee, we need to think about this as we put out there other projects, similar projects across the state. The state is planning to go back out into that region of the state and put out another RFA or RFP and do that fairly quickly. And that will likely expand the geographical area And again, I'm not just telling a story here because I think what the state's doing in Washington County, something we absolutely need to think about with our two projects in Androscoggin and Franklin County. So we are expanding the territory to include area that's somewhat contiguous to Washington County. I've not seen the final draft, but I think it's going to probably allow for a facility that serves Washington County and other areas in down East Maine, but does not have to be located in Washington County, but has to be within, say, 10 miles of the county line. That, by the way, allows them to pick up, potentially somebody could use these funds to buy Bella's house in Springfield, which is 8 miles away from the county, Washington County line. I also believe that more money is going to be put into the project. And I think a different timeline will be proposed because people objected to the timeline on submitting the application and also implementing the project. So I think based upon those 3 or 4 changes, that there will hopefully be applications, but we can't be absolutely certain of that. So when I told that story, Joe then asked if I would talk to people, talk to organizations in Franklin County and Androscoggin County to see whether I thought that there would be applications for our project. There would be organizations interested in doing this. And in Franklin County, they really hadn't given it any thought. But I was invited then to come to Franklin County and kind of convene all the prospective parties and think about whether one or more or collectively they could, in fact, envision within a reasonable time pulling this off. So I think it's a ways away, and that meeting has not been scheduled, but likely would be in no later than late April. Androscoggin County is a much more positive story because there was already an application submitted for a detox facility with responding to a previous RFP at the Office of Behavioral Health, and it didn't get funded. There were, I think, 9 projects submitted, and I think only 4 or 5 got funded, and that project didn't make the cut. So I've talked to the organizations and principals behind that, asked them to please dust off their proposal and be thinking about it as we take our steps, frankly, to effectuate our decisions in December and start drafting an RFP. So I feel like there will be applications in Androscoggin County. In Franklin County, I simply don't know. And based upon what I've seen at Milestone, Wabanaki, Washington County, and also a project that you've heard me talk about in the town of Washington, I think if you start from scratch, it's about 2 years before we can get a person in a bed, in my opinion. If you've got to buy property, hire staff, train staff, and all of that. I'll just make one other comment, and that has to do with the Wabanaki beds, because I met for an hour yesterday with staff at Wabanaki because they have 6 beds open, and there's a proposal to expand to 10 beds. But they are struggling. And I mean, there are, and here's why they're struggling. They're new. And so, many people don't know about it. Number 2, workforce. And what I'm worried about now is if we end up with 7 or 8 detox facilities around the state, right now, people are just stealing each other's staff. We're not
Correct.
growing the pool of people to be able to work in these facilities. And of course, for the nursing staff, they're competing with the hospital. So it's an enormous challenge. You also have, it's very expensive because you have 24/7 staffing, of course, and you have people who then don't, who you've reserved a bed for, and then they don't show up. There were 3 no-shows that we talked about. And then there were 3 or 4 people who left against medical advice. So now I'm gathering up some data from Milestone and Wellspring to see, well, how often does that happen? And then of course you have the issue that I'm very interested in learning about Wabanaki, because I want to know where the patients go after the 5 to 7 days, even for those who have stayed and had a successful experience. So I share all this with you, take up your valuable time, just so that people have an understanding. This is really hard. It's really hard. And, you know, I think we need to be thinking about that as we put together these 2 projects that we've committed funds to in December, in terms of how long it's going to take, how we put the RFPs together. And that's what I have to report. Yeah.
Gordon,
And
do you think it would be beneficial for the council to put out a letter of intent to those 2 counties just to see if there's an interest? Or is that just a waste of time?
well, no, I don't think that that's necessary to do right now, because again, in a way, it's a small state. We can talk to people. We have a very good coalition of organizations in Franklin County. And I think probably I'll come back from the meeting in late April and have a pretty good idea as to whether the organizations think that a project could be located within Franklin County, or whether they actually suggest that we broaden the, our decision in December was fair. I don't want to say it was arbitrary, but we talked about Western Maine. We talked about wanting to serve Western Maine. We could have said Somerset. We could have said Piscataquis, Oxford. We laid it out there for Franklin County. Well, we don't want to wait a year because there's a facility across the line between Franklin and, say, in Livermore Falls, for instance, which is in Androscoggin County, but really it's closer to Farmington. So I just think we need to realize the more stringent we are, the more, that's not the right word. Brendan, help me here. The more requirements that we have, the more narrow the proposal, the less likely we will have anybody interested in it. I think that's my thing. So that we might want to modify our decisions in December by saying, by putting that application out to 4 counties, as long as they're serving the area of Western Maine, that so that people aren't driving for detox services to Bangor or Portland. So I don't think at this point that in Androscoggin County, we could talk to Brendan and Ben about there, if we know there's a viable proposal that's really supported by the 2 hospitals and the significant organizations there. Remember, Tri-County is about to merge on April 1st with Spurwing. If those organizations all get together, maybe we could sole source it and save a lot of time. That's another thing to think about.
Yeah, Courtney noted that in chat, that she said, one of the comments that she said, would it make sense to fund a specific program like we did in Piscataquis County, rather than go through the whole bid process? If they brought a proposal to the council and the council's able to review it, ask questions, would be able to do that, and that may slow the process down, because I know from experience that it is a unique application. It is a unique organization that's going to want to do this. So those are things that we may do, and we'll be, again, interested to see what happens in April.
Right.
Also,
Go
ahead.
Well, I think that's absolutely right. That if we can save time, and if we have most of the community supportive of a given application, that it's more likely to be successful. I also think that we need to think about, with the state, we really need a continuum of care, and we need a system. So I want to make sure, for instance, if one facility is full and another facility has beds available that night, that they're talking to each other.
Yep.
I'm not certain that's always happening. So we've got a lot of work to do here, but I think the bottom line is that now we understand we do not have people knocking on our door saying, boy, I want to put up 10 detox beds in Maine and help people with active addiction who are ready to get help tonight. This is gonna really be a public-private partnership, I think, that says, okay, how many beds do we need? Are they full? How do we keep them full? Where do people go afterwards? Otherwise, we just do siloed projects, and at the end of the day, I don't think we help enough people.
I think it's a good thing. I know Miles has a couple questions I can answer. Miles has a question about, do we know the Maine Care reimbursement rate for detox beds? That's in the regs.
Yeah,
Miles.
no, we know that we increased them by 76% 2 years ago.
What is that? Do we know off the top of our heads? Just curious, or no?
I mean, I had it the other day. I don't have it in front of me, but we can easily get you that daily rate for detox. Yeah, it's quite. I mean, it's almost twice what it used to be.
Which is good, because I know what it used to be all too well. And then he commented about the staffing issue. And again, I think it is something that at some point in time the council has to look at, is what can we do to help workforce development, because it is an issue, particularly with detox. I know that in Bangor, we struggle when you have hospitals. You have 3 hospitals. You have Acadia, you have Northern Lights, Acadia, you have the hospital, and you have St. Joe's, and then you have PCHC. You are competing with nursing staff, and we just can't pay what they pay, nor the benefits. So I know that's an issue. All right. Any other questions for Gordon in regards to that? I think we have some direction. We're going to sort of sit and wait. And I do think we do probably at some point in time need to have that conversation about looking at this being a proposal, direct proposal versus RFP. We certainly would save some time.
Let me say this too, that as soon as we get the application so that we can have an equitable process, and I know people working very hard on that. Yeah. There is that project that I mentioned at the last grants meeting that and Courtney and I visited that property. I can't speak for Courtney, but we went over there a couple weeks ago. As I say, it's in the town of Washington in Knox County. It's 30 minutes from Belfast, 30 minutes from Rockland, 30 minutes from Augusta. They have sent a letter to the council. They put in not just the letter, but they enhanced it with a budget. And they are willing to put 8 detox beds on the first floor of that facility. And then there would be residential beds upstairs, I think about 8. And they are about, I mean, physically that structure is about ready. And they said at the end, they thought they could do this by the end of the year, but they've since come back to me and said, if we had the money, we think we could open September 1st. So, when you're ready to have the discussion, I might well be interested in, all right, let me just posit this. Let's say I get over to Franklin County and they think, yeah, we really, we're using the 40 new beds in Portland. We really think we should have detox, but we really estimate that it would take 2 years. And what would be helpful now would be a small planning grant to help us get started. Then I'd say, okay, let's keep $500,000 for planning purposes in Franklin County for them to work on that. But let's take the $1 million and put it in the town of Washington, because I can have people in those beds. That's going to be all women facility, by the way.
All women.
But we could have women in those beds in the next 4 months. And I just think, based upon the town of Washington, the experience of Washington County, where we've got Bella's house too, likely that maybe could be reopened. As I say, if you go from scratch, it's going to take 2 years. If you've got facilities that are 80% done and just need a little push to get open, and could do it in 3 or 4 months as opposed to 2 years, I'm really interested in that. Now, whether it's money that I can find on the state side or whether it's Recovery Council money, I do think that probably in a meeting or two, you're going to see me advocating for that when you're ready, when you think when you think it's equitable. These are not the kind of projects where very many applicants can actually be successful at it. All right, I've said too much, but that's my report on detox that Joe asked me to share with you.
Well, thank you. Miles asked the question if it's the licensing that takes that long. That's a yes and a no.
The licensing's a piece of it. Takes a while because you've got 3 pieces of license. You've got licensing of the facility itself. You've also got main care enrollment that frequently takes longer than the licensing. And then you've got an OBH contract that might support payment for the uninsured. So you got 3 pieces of licensing potentially.
Always fun. Courtney's question. Instead of an RP, talking community. Is there another one I can't see, Courtney?
I just wanted to jump in. Gordon said he couldn't speak for me about the project in Washington County, and I just want to reiterate that he is Washington City, the town of Washington. Town of Washington, not there's too many Washingtons. The detox for women in the town of Washington is a beautiful project, amazing, like shovel ready to go. And I would be very open to a conversation about reallocation of the current funding that we've already allocated to detox centers. I think that's a separate reallocation conversation is a separate conversation than new funding going out through an application process. I'd also be very open to, if it makes sense. I just know that we need detox beds. I don't know how to run detox beds, not my job. So if there is somebody ready to do that, then I would be open to a conversation about a direct source to them. Instead of a RFP process. I would rather have beds online sooner, if it's the money we've already allocated.
Thank you. Brendan, you had your hand up?
Thanks, Pat. I just want to chime in with the, sort of wondering or suggesting that this might be an example or an opportunity for the council, whether it's particular members or otherwise, to coordinate and collaborate with the subdivisions there, the counties, the towns, who both who might, to try to bring them into the planning and discussions about these things. Some of the possibilities could include, could if multiple subdivisions and the council are involved in the same, project or same proposal, could the funding be staggered or laddered in a way to help them get online, sooner, or to cover parts of it and others cover other parts of it, and to get buy-in in the local community, as well as to engage in the local planning process to find out what they've been talking about. That's all.
Yeah, I love that idea because it gives a town ownership to that. And again, we all know that Maine Care won't cover the cost of everything to run a detox. So this gives them another source of income to do things that they may want to do. Good suggestion. Any other further conversation about the detox? All right, well, we'll keep moving forward, and probably again, once we see what happens with the one in Washington County, look about the possibility of either reallocating our funds, looking at one particular program versus RFPing it, so we have some options. I think we all are in agreement. The fastest we can do this is the fastest we can get these services to people is our goal. All right, so I am going to ask you, Brendan, because I know that you're getting off and being on the phone at 4. Can you just talk a little bit, just just a little bit about any contracts that you want to update us on, or where we are with those contracts?
Sure. I've had, so, we have this document that Joe circulated, I think it was yesterday, from the folks in Piscataquis, which is the contract I am most focused on, as well as other work that I'm focusing on for the Attorney General. Piscataquis is my primary focus. And I've been talking with Gordon to try to assemble, other existing contracts that I can look to as templates for some of the unique circumstances that Piscataquis presents. Having said that, I don't foresee them to be obstacles that, could derail anything. I'm just suggesting that, there are some unique circumstances that I, will need to take into account. And existing contracts for recovery centers that the state already funds, are the templates I'm looking at. I've spoken with Gordon a little bit as a follow-up from the Recovery Council meeting on Thursday, to, ask for, guidance and thinking about sort of the payment structure, as well as for, what reporting would dovetail with the payment structure. And there's a couple other requests I've made about the organizing documents for Piscataquis County, and I understand those are being gathered. And so today I was due to be in front of the legislature. That didn't happen. It could resurface, as you all know, sort of at any time. But I have blocked off for myself the next couple of days, the rest of this week, any free time, any non-meeting time I have, I blocked off to work on contracts. So that's what I'm going to be doing for the remainder of the week, with, the assistance of the, others who are helping to put materials in front of me. There could be things that I have forgotten or omitted from saying that others are trying to help me with. So I want to give others the opportunity to remind me about things that they're providing or helping me with.
Any questions about contracts to Brendan?
Also, let me just say, I very much view this as the beginning of the sort of general template for the council, that once, I have this done, different actions by the council are going to require different levels of, contracting. Some of them ideally would be quite simple. Some of them will require more oversight. And so I view this as the starter version of a template that can then be handed off to other key staff or people to flesh out much more quickly for future work.
And getting that first one out is always the hardest part. After that, they'll be hopefully a whole lot easier. But they all will have unique parts. Questions about contracting? Thanks for all that. I know that that's tedious work, and I know that you're on the fast track, because we know that we don't want Piscataquis County to lose that building. So hopefully we can make that happen for them. But thank you for the work on that. All right. So the next item on the agenda, I was hoping Joe would be here before this. It's not. So we're going to talk about the application process. And first, I want to say a huge thank you to Ella and Mary for putting out that draft in regards to the application process. I know how much research and effort went into putting that together. And this is the part where we sort of have to look at the details and be willing to switch things around. But I was very impressed with the first stab at it. And as we move forward, we certainly can adjust it. But I think it's an excellent start, but that's just me. So Courtney had a proposal, and I just will say, to Courtney, thank you for doing this. Just a little bit confused about the instructions. Other than that, I guess I will let you talk about it and then save my questions and everyone's questions till the end.
Yeah, thanks so much, Pat. I just dropped the document in the chat if anyone wants to follow along that way. I don't know, Haley or Ella, if you could also drop it for the public if it's a live link, so they could also look at it that way. If it's possible, could I also have screen sharing permission?
Yes. I don't know if I can share it. I can definitely put it on the website, and I'm going to try to send it to the people watching now.
Okay, awesome.
And
Thank
I'll
you.
make you a co-host.
Okay, great. I have it. I'm going to share a PowerPoint in just a second, but I just wanted to start off by saying, I also, Pat, you are 100% correct. I'm so grateful to Ella and Mary for all of their work they've put into the application process. And also this, what I'm about to try to do with all of you is not to second guess or to change that work. It's more so to create clarity for myself and maybe for others on this call. I've just been, and it could be because I missed last meeting and it was really hard to, kind of understand what was happening on the Zoom after I watched it, even after I watched it twice. So I've just been a little bit confused about where we are in this process and what decisions have been made or haven't been made. And so in a conversation with Gordon over the weekend, I expressed that confusion to him, and an idea came that maybe it would be helpful if the council had a list of questions of decision-making points for the application process and options for those, not so much that maybe those decisions have already been made and I just don't understand what has happened, or other people don't understand what has happened, but just to help really clarify for both the council members and for the staff about what decisions have been made and make decisions on what hasn't been made. My hope and my intention was to take us through that as a facilitator, not as somebody, and the document doesn't have any of mine, Mary's, or Gordon's opinions as part of the document. It's really like a process, a decision-making process. And so I'm happy to do that. I also don't know if others want to do that, but that was the conversation that Gordon, Mary, me, and Joe had. Again, just for clarity, Brendan, we did not talk about any substantive issues. We just talked about process and how we move forward. So, yeah. Brendan, did you have something?
Yeah, just as we go through this exercise, however it happens, does the committee want, as I mentioned in my email, a lot of work has been done already. Does the committee want, to extent sort of Ella may or Mary may know of, like, yes, we've found an answer to this. It's here in this particular document, you know, we can point you to it, or we can answer that question, or we have, you know, maybe that question's not as simple as it sounds, and we want to add, you know, concerns, or like, here's what we've discovered, you know, do you want to invite that input, or do you intend this just to be sort of council members making tough decisions?
I mean, I am very open to Mary and Ella's. If the decision's already been made and somehow like I just don't understand it, I want to be told that. And then also just to have a record, like a very clear record, because I feel like some of these decisions have been made in different meetings or like at different points, and they're sometimes here and they're sometimes there, etc. So my answer would be yes, but I look to fellow council members if they also want that. Liz?
Yeah, thank you. Thank you so much. Courtney, thank you for doing this. I feel like this is going to be super helpful. I feel like we haven't made most of these decisions. And I think that was part of what was happening when we go through the application process. It was like super challenging because we haven't made some of these decisions. So having a way, a process for deciding these things, I think sounds great. And then they can get folded into the contracting. Of course, I would love if Ella and Mary, you think we've already made the decision, great, please say so. I feel like most things haven't been made, but I look at this, I don't remember making these decisions. And I think it'd be helpful. And I think if there are ones that need a lot more conversation or like can't be answered, maybe we can say, okay, let's table that one for a whole council meeting, or like, let's get through some really easy ones. Or maybe we just need to dive in or have people walk away and say, let's come up with a proposal for how to answer this one. I specifically have some thoughts on a couple where I think a proposal might be helpful, as opposed to like open-ended answers. But anyway, I love it. Thank you, Courtney. I'm excited to be a part of this.
Thanks, Liz. Any other questions or thoughts before I jump in? Okay, so I've done this process with groups and organizations and people a lot. So this is my suggested process, and I'm very open to feedback that I could definitely be wrong. And, you know, talk to Gordon and Mary about this, is that I'm going to present a question. I'm going to present some options to you. I'm not going to give you my opinion on those options. And then you all are going to talk about those options. And I'm hoping that you will, you know, motion for one of said options, or if we need to table it, like Liz said, and come back, then that is totally appropriate too. But really to try to have a clear understanding of, as we move forward, where we are going. Is that okay with everybody? Can you just give me like a thumbs up? We hate this. Okay, thanks so much. Okay. I also made it cool. This is not the official logo of the Maine Recovery Council. It's just something that I made. Okay, so this is a decision-making process for the application for the Maine Recovery Council. It was drafted in collaboration with myself, Mary, and Gordon. I've already covered some of these instructions, but the intention of this practice together is to evaluate the questions in the documents, choose a response to the question through a motion and a vote, and recommend it to the full council for the April 2024 meeting. And then the council obviously has the final approval of any decisions made by a committee. And I'm hoping that the council would review your recommendations on April 11th of 2024. So the
Excuse me,
first,
Courtney, are you voting on the whole document, or you're voting on each question?
each question is my intention. Is that not how you would like to do this, Pat?
No, it's fine. There's
Because
like,
the document is, and we might not get through 17 questions this
yeah,
afternoon.
there's 17 questions. That's all. It was like,
Yeah, we might get through 12. We might get through 4. We might get through 1. This one, I would hope that I'm actually going to try to facilitate you that you get through more than 1, but maybe not 17. So Joe does understand that this could be a secondary process for next time. Okay, so let's just jump in. So these questions build on each other and try to bring us down through a decision-making process. So the broadest question is on the table is, does the council want an application process to be the only way of allocating funds? Yes or no? And if no, then what are the other ways that the funds would be allocated? And if you just want to raise your hand, if you want to respond to that question in particular. Pat.
So no for me on that. In my if I in if I in my head, I would love the council to be able to have an application process, but also have some allocations to be able to do innovation funding, or maybe do a project of their own. So I wouldn't want to see all of our funds spent on an application process. We look at workforce development, and could we do something with that? So for me, it's a no. I would like to see us say each year or every 2 years, we're going to allocate this many $1 million. This many $1 million will be allocated on innovation funds or a special project of the council.
Awesome. Thank you, Pat. Liz?
I guess I'm gonna say that I would prefer that all projects end up in an application. And so I guess I would say yes. And I think we can do applications for innovation and applications for, one idea might be to have, if we wanted to make sure that we're funding something in every county, we perhaps give out funding to a philanthropy that wants to do like something like Maine Community Foundation, who could do 16 they could do small funds for 16 projects, and they could manage that. We could put out an application process to philanthropy, who could give out grants to 16 different projects and have a community engagement process by which they decide what should get funded. So I think we could have unique ways of using the application for multiple things. But in the end, all projects should have some level of application so that we have all that information and we know how people are going to evaluate it and we know how they're going to spend the money and there's a budget.
Okay, so I hear Pat, I hear you saying that you really feel like it's important to be able to innovate with some of these funds, as well as for the council members individually to maybe have a project that they care about that they can bring towards the council. And Liz, I hear you saying that you agree with Pat to some extent that yes, that is all important. And also the project should still have to fill out an application to be able to gather all of that information. Am I hearing you correctly?
Yeah, thank you.
Thank you. Is there anybody else that would like to respond to this question? Miles? And then Gordon, sorry, Miles raise his hand first.
Yeah, I like, again, I like both where Pat and Liz are with this, but I feel like I kind of lean with Liz on this, that even though, like, I feel like everything that going forward should have an application process. It might be real tedious. I know that I'm working on something right now, and it might be tedious, but I think that there should be some sort of application process. Like, we can still allocate money towards something, but there should be a process within that allocation.
Okay.
If that makes sense.
Yeah, I think I'm beginning to hear consensus with a little bit of different flavors of what everybody's saying, but let's get Gordon in here, and then I want to ask Mary and Ella if they believe they have anything to add.
Oh, I mean, I would primarily vote no on this because I don't want to tie the hands of the council. I think that the application should be the primary way that we'd allocate funds, but there could be an emergency situation that we want to get some money out the door. There could be So I'm not sure if sole sourcing contracts would necessarily involve an application process. So I just don't want to tie the hands of the council.
That makes sense. And maybe also what I hear Pat saying to some extent. Mary and Ella, is there anything you would like to add to this part of the conversation, or has there been a conversation about this that I am unaware of?
I'll jump in. We've discussed this, but really focused more on a process working under the assumption that all of the funding would go through a grant application just to make sure that option is available. I don't feel strongly either way about this. If we do decide to have more than one process for allocating funds, I would just ask that the council, which I assume we will do, talk about that distinction and how that changes eligibility for the grant application.
Thank you, Mary. Dr. T, I saw your hand briefly.
Oh yeah, I was just going to chime in. I mean, I feel like I agree with everyone to a degree, but primary application process. But I do wonder if we should earmark like a bit for an emergency fund, just given like the unsafe supply and like we don't know like if we have to respond to something, or if we're going to earmark something for, let's say, maybe a future overdose prevention site or something like that, just to keep an emergency fund on hand. But I agree with the primary application process. I guess one caveat would be, and I think we talked about this in the beginning, is having some technical assistance, especially for smaller programs, because I do worry I wouldn't want the application process to prevent smaller programs, grassroots programs from applying.
Okay, thank you. And I'm seeing some comments in the chat. I'm curious if maybe there could be, I wonder if it changes anything if I was to edit this question to say, does the council want the application process for a period of time? Like this part of our process, if it wasn't, this question is bound to forever, it seems. And I wonder if it would be an easier thing if it was bound to the end of the year as we go through this particular process. Would that change anybody's opinion?
So it's not going to change my mind in the fact that I agree the primary process should be application. But I always like that little contingency fund because, COVID hit one day and we never expected COVID to hit. And it hit hard. And so for me, I think Gordon said it well with, I don't want the hands tied that if something comes across us that is absolutely crucial, that the council doesn't want to get involved, and we've made this arbitrary saying. So for me, I'm safe in saying majority of our process is application, but there has to be some that are at the discretion of the council.
Okay, I'm curious is there, when you say majority, what do you mean? Is there like a percentage that goes to the application process and a percentage that goes to the innovation emergency fund?
I think that's a larger conversation. I certainly would want more than 50%. If it was me, I'd want at least more. I'd want more than half to go to an application. But I don't know. I'd have to look at the way we decided to budget money before I could say a percentage. But certainly, I would want a percentage of it to go through applications.
Okay,
a large percentage.
Brendan?
I'm sorry, I was off the call for a minute there. I wonder if this discussion about percentages could be simplified a little bit to the concept of the default is applications, with exceptions being, with room rather for exceptions where the council decides to, do a sole source or something like that.
That sounds very close to a motion, and I'm curious if anyone would be willing to put forward that motion and if there's consensus in the room.
I make a motion that we take what Brendan said.
Okay, I heard the motion to be in Brendan.
Hold on. Yeah, I was gonna say I need the motion repeated to even get remotely close to it in the minutes.
Okay, Brendan, do you want to repeat a motion on the record for us?
Well, Like I mean, I can tell you somebody else would have to make the motion because I can't. So my suggestion would be that the council's position on this could be that its default is to use an application process for its grants, and while allowing the council the freedom to not require applications in circumstances where it determines appropriate.
Does anyone want to make that motion? And Chastity, did you get it for the minutes?
Yes.
Okay,
I'll make that motion.
perfect. Do I have a second?
I second that.
Great. Ella, do you want to call the roll?
I can do that.
Sorry.
Liz Blackwell Moore,
Yes.
Todd Brackett. I can't see who's here anymore now with the screen. Joe
I
Everett,
don't think Tom's here.
Pat Kimball,
Yes.
Bruce Nodden,
Absent.
Miles Alette,
Yes.
Gordon Smith,
Yes.
Keena Thakrar,
Yes.
and Chastity Toole.
Yes.
Wonderful.
And that's 6.
Thank you.
Passes.
Great. We've got our first unanimous consensus. Okay, moving on to the next question. What time, do we have anything else on the agenda, Pat?
No.
Okay. Brendan.
Thanks, Courtney. Because I have to switch off video and go to phone, and so yeah, I'll be able to be somewhat less involved. I just want to provide a comment on question 3 at this time for your consideration when you get to that question. So I don't mean to go out of order. I just want to add something while I have the opportunity, if that's okay.
Yes, go ahead.
One question I have as in my role of providing legal advice to the council is the extent to which the council is able to provide funding to for-profits. And let me describe just briefly my general thinking. I haven't come to a conclusion about this, but in general, as you all know, the funds are supposed to be used for opioid abatement activities as described in the exhibits to the MOU. To the extent any of the council's funds as part of a grant go to the profit of a provider, there's an argument at least that those funds are not being spent on abatement. Initial research that I've done indicates that it is, let me just say that my research so far is inconclusive. And it seems that at the moment, it could be a policy decision that the entities who can, grant these funds, including the council, have the ability to make. But I just want to flag for the council that that's something I'm looking into. And even if it's not directly prohibited by the settlements, just note that at least in my research so far, some states have made, I think, and Ella can correct me if I'm wrong, the decision not to provide grants to for-profit entities. At least one state has made the decision to allow grants to for-profit entities. And so, it could be a policy choice that the council could make.
Wonderful. Thank you so much.
Keep in mind, the majority of the MAT programs in Maine are for-profit companies.
Thank you, Pat. Brendan, we will keep this in mind as we take up question 3, but I'm going to try to keep us on question 2 for now, because I think question 3 builds on question 2. So thank you, Brendan. So just so I'm clear, if you have to jump off, you aren't saying that at this present moment, there is no restriction on doing so, but you're just raising it for our consideration as we make a decision.
Yeah, I'm still researching to the extent to which there is a restriction of the funds going to for-profit. So, I anticipate I'll have a conclusion to that research, well before the council gets to the point of potentially making grants to for-profits.
Okay, so if the recommendation of this committee is to include for-profits, it might just have a little asterisk that's aside until Brendan finalizes.
Pending, yeah,
his-
correct.
Okay, great. All right, so let's move on to question 2. We've determined that there is an application process and a majority of the funding will go through said application process. And so what is the application process that we're talking about is the question. What is the process for the applications? And we're looking for you to pick one or some version of these. First being that the applications that we're creating right now will be considered the full proposal and scoring will begin from those applications that we receive. Another option that I've seen grant making bodies do is request organizations to submit a letter of intent, then have the council or the grant committee as an option, determine who from those letters of intent will be invited to write a full proposal to the council. So B is that we would do that, and then the council would decide who is invited to a full proposal, or C is we would have people submit a letter of intent, and then the grant committee would decide who is invited to a full proposal. Thoughts on this process? Liz?
Hi, thanks. I love the idea of doing the letter of intent and getting some information from folks to ensure that people qualify. There's a lot of we just have a lot of things we're still learning about the legality of a whole bunch of this stuff and the uses. And so I think having people share what they're going to do, what the approved use is, and how it fits into if we end up having priorities, and then asking people so that people don't spend so much time and they're not even eligible because it's just so much work to write a proposal. So I would go with C personally, but I could be convinced to do B if the whole council wants to be a part of it.
Okay, so you would be in the C, maybe B category, but you would want organizations to submit a letter of intent. And then from that letter of intent is an intentional move towards whether or not they're being invited to submit a proposal.
Yes, and I would say that mostly for their sake, for us too, but mostly to save them if they don't qualify or for some reason we've decided so that it doesn't put too much burden on them.
Okay, and before I go to Pat, when I say letter of intent, I want to just clarify that we're both on the same page here. We're talking about a 1-page letter from an organization saying, I want to apply for X thing. I want this amount of money. This is a little bit about me, and this is a little bit about the project. Sign the executive director.
Yes, and we could have a letter of intent template that everybody uses.
Okay, thank you. Pat?
So I agree with Liz, but that's not what C says. C says application will be considered in full proposal and scoring begins.
Oh, I'm sorry. I moved them I apologize. And they're backwards it's my fault. My PowerPoint is different than the.
Oh, okay. So yeah, the letter of intent is certainly, for me, the reason the letter of intent this first round is so important, we have no idea whether we're going to get 5 applications or 5,000. I don't think we get 5,000, but so for me, if you ask people to do the letter of intent, at least we know our workload, and can do that. So for me, the letter of intent with Courtney's description, 1 page, very simple, and it does us 2 things. It tells us if someone applies and they're not even eligible, we're able to tell them, but it also gives us an idea of our workload. So I like that one better.
Okay, thanks, Pat. And to just double check, let me reflect back to you. So you would be more in favor of the letter of intent. And does the letter of intent, that is the process in which the council or the grant committee decides who's going to be invited. So it's not just like this is, hey, we want this thing, but it's part of the process of how the next phase of invitation happens?
Mhm.
Okay, and are you in the world of the grant committee reviews those, or does the full council review those?
Think having, I don't think I can answer that question until I see the process of scoring. I don't know how that is, so I don't know where it belongs. There's a part of me that says 15 people scoring all those grants is a lot.
Okay.
Not everybody wants to do it. So for me, I'm comfortable with the grants committee looking at the letters and determining, who applies and who doesn't. Certainly with sharing that with the committee. But if you're talking about the grants committee scoring them, I don't know. I can't answer that question yet.
Okay, Miles.
I agree with Pat. I think that's B. Was that
Yeah, on my PowerPoint it is, I apologize. Organizations will submit a letter of intent
then the council?
and the council will decide who to invite. That's the
Yeah,
full
I
council.
and I understand that it's probably a lot, but I think I feel like the full council should be involved on who. I feel like the full council should be involved on that in that, but that's me. That's my thought, but I like B.
Okay, so we're in the same trajectory here. We're kind of in the weeds on who's going to do the work, but that's great. So Mary,
And I apologize if I missed this, but are we thinking a letter of intent that will go out now before the funding priorities are set, or will that happen after the funding priorities?
I think that's still up for discussion, as there's
Okay.
another question about what is included in the application, which now application may need to be changed to letter of intent throughout this whole document. I don't think I'm going to keep my opinion out of this because I'm facilitating, but what do others think? Should the letter of intent go out today, or should the letter of intent pause for a minute until we have more of a process? Liz?
I actually have pretty strong feelings about this. And I think I've aired those at the council meeting, that I have pretty strong feelings that we should get really clear on what we want to fund and how we're going to do those. And you have some great questions in here about how, like, amounts of money and what size grant. And I think that we should get to those questions before we send out a letter of intent, so that people have a sense of what is even feasible and what we are looking to fund. I think just doing a blanket letter of intent, I mean, we have people here that could send in 5 proposals, but we wouldn't if we knew what are the parameters. So I think we should choose the parameters first and then send out a letter of intent and have people submit a letter of intent knowing what the parameters are.
Thank you, Liz. Pat, and then I'm going to ask anyone that hasn't spoken on this topic to please jump in.
Mine's quick. I 100% agree with Liz.
Okay, great. Others?
Sorry, it's hard to do minutes and talk. So one thing before we go to that, I agree with Liz on that. I agree on letter of intent. However, I think it should go to the grants committee to decide who to invite. We may not invite them, but we can decide who to invite and then bring that to the whole council if the council wants to, but the grants committee was made for a reason.
Ooh, I think I'm starting to hear a compromise or a consensus here. I wonder if maybe people are saying that the council or the grant committee at this time would like the process for applications, the application process, to be that organizations submit a letter of intent after we have some more conversation of what that letter of intent is going to mean or cover. And then the grant committee will be tasked with reviewing those letters of intent, and the council will have final approval. Like, y'all do the work and then it comes to the council for the 3/5 vote to confirm your work so that there's, I don't know, that's my offer. That's what I think I hear people saying.
And I could, I could, I could compromise with that. I know I was one of the folks that had said the full council, but yeah, I could be down for that.
Like checks and balances, right? So everybody gets to apply in the parameters that aren't set yet. Then the grant committee does the work of reviewing them, and then the council has final confirmation of the 3/5 vote. If there is something that was missed by a counselor, that is, if a counselor feels that they missed something, they could bring it up at a full council meeting for final confirmation. If
I
that's,
would be okay with that. I think again that we need to do a little more work on our prioritization before inviting letters of intent. But once we have the letters of intent, I think there's a role for the grants committee, and I think there's a final role for the council. So, and recognizing, I think there's 9 of us on the grants committee. So it's going to be kind of unusual for the grants committee to make a recommendation that's doesn't come in with pretty solid support of the council. We'd have to do a pretty crappy job of selling if it was unanimous. If it was unanimous.
there is a governance issue there that like I'm trying to facilitate, and I'm not going to say anything right now, but we can talk about that later because that is
it's on the agenda for the governance committee to be discussed because that is an issue.
my
Governance
governance hat is on fire right now. It doesn't seem fair, but I am facilitating and I'm moving on. So would somebody like to make a motion to that effect?
I'll tell you what I already typed if it's okay for the motion from myself.
Yep, that's fine.
We're going to get organizations submit letter of intent. The grants committee will review, make recommendations on who to invite to apply, and bring back to the full council for a vote.
Is there a second?
I would
And-
like to, I think we had this addition of the letter of intent will be sent out within the parameters, within the, when we know the priorities. Right, you put in that piece, Courtney, about the like that we wouldn't send
Yeah,
it
it's
out
the
until-
intention of the council in this motion is not to send for Haley and
Yeah.
Mary
Okay.
to send it today.
Okay, so great, I'm sorry, Chastity, I second the motion.
Mary, is that clear for you? Okay,
Yeah, that is.
great, thank you. So Chastity was the motioner, Liz seconded. Haley, do you want to call the roll?
Yep. Liz Blackwell-Moore,
Yes.
Todd Brackett, not here. Joe Everett, Courtney Gary Allen.
I'm not.
I'm here, Haley.
I have the wrong committee's sheet up. That's my bad. So Liz Blackwell-Moore, Todd Brackett, Gordon Smith,
Yes.
Joe Everett, Miles Olet.
Joe is back.
Oh,
Yeah, Haley, sorry. Yes, for me.
okay. I wasn't sure how long you'd been with us. Chastity Toole. Oh, I skipped Miles. Come back.
Yes.
Miles Olet,
Yes.
Keena Thakrar,
Yes.
Bruce Nodden, Pat Kimball.
Yes.
Right, that's 7.
Motion passes?
Yeah.
Perfect, thank you. Hi, Joe, welcome. We're on question 3 and we're about 20 minutes in, but we're making headway. We've had unanimous vote for the last 2 votes. Haley, I'm muting you. Okay, so the next question is, we have decided that it will be a primarily application process with some leeway. We've decided that there will be a letter of intent, and then they will be invited to full applications. Who is eligible for said funding? And the options, I just provided every type of option, so I don't there's no, there's, my opinion is not here. 501c3 nonprofits, 501c4 nonprofits, for-profits, and individual people. If you want to just raise your hands, I see Miles.
Sorry,
Lose
try
you?
to unmute myself. I think everybody should be eligible personally. So A, B, C, D.
Okay. Do you want to elaborate, or you're just, that's good?
I know there's been, I know there's been some talk about with the profits, and I know that we can figure that out. But like Pat had said, most of the map providers in the state of Maine are for profits. In terms of sustainability, and a lot of the nonprofits are dependent on grants, dependent on grants to survive. I feel like in terms of stability and growth in the state of Maine, it's going to involve both for-profits and nonprofits. Uh, I think going forward, we'd look at some of these not for-profits to see, to dive a little deeper before we accept some of those proposals. But I just feel like everybody should be able to apply. Uh, everybody should.
Perfect. Thank you, Miles. I hear you saying that it's important to you that everybody has an opportunity to apply regardless of their status or lack of status, including individuals. Others?
I agree with Miles. Individual doctor's offices are for profit. Somebody puts in that they want to do a project. Enough's been said. All of our OTPs are for profit except for Acadia Hospital. I think it'd be a real mistake to, at this point at least, limit eligibility. We might have certain applications that we limit eligibility by, but not as a rule.
Okay, thank you. Is there any, Joe, just so you know, you weren't on the, and I don't know, I think Brendan has dropped off at this point. But Brendan, before he left, did raise a legal consideration that he is currently researching, that he's not 100% sure if for-profits are eligible for this funding. And he said that we can make a decision that we want to make, but there may be a small little asterisk next to for-profit until he makes a legal recommendation to the council. Is there anyone dissenting from Gordon and Miles so that I can help keep the, not dissenting, that's not how I want to frame it, but are there any other thoughts different than Miles and Gordon at this point? Liz?
I just would add units of government, including tribal governments, because units of government are not any of those. And if we keep on non for-profits, then I would just urge us to have something in when we do the point system where organizations that, like in the budgets, that we account for that in some way to give more points to those who are not taking profits, or some way to manage some of that.
Okay, I think that's definitely a consideration we can raise the score discussions. I said governmental entities, is that the appropriate term?
I think most like in the grants, I was just looking at a federal grant. They call it units of government.
Okay.
And then I would just include tribal government, but say including tribal governments, because there are some distinctions.
Does that include schools?
I would say yes.
No.
No?
No, I don't think schools are considered governments. I think you might have to.
Because if a school had a great project, you wouldn't want to.
Oh, yeah. I'm just saying you might want to say schools or units of, let's just put units of government, and we can put like, we'll look into that as like.
But Pat, you're raising, Liz, you're raising, you want the government of all types, including tribals, to be able to be included in this. And Pat, you're specifically calling out public schools, which have 3% of our funding anyway. So of course they need to be eligible.
Well, you can say public or private school.
Great, thanks. Joe.
Courtney, can you hear me? Sorry, this is hard, but I need more clarification around what you mean by individuals.
So this was actually something I heard on the grants, the full council meeting. So I believe I heard Gordon bring it up. So do you want to answer that question, Gordon?
I'm sorry, I was multitasking for just a second. Can you repeat the question?
Yes. Yeah.
So Gordon, my question is what we mean by individual?
Oh, by individuals? Well, just that a lot of people in business, in small business, they don't incorporate necessarily. And, a good example is that, an individual physician practice or a therapist practice, for instance, many of them practice as licensed individuals. They're not corporations. So that the ability of a medical practice or any other therapy practice to do a mini grant with us or something would be impaired if we don't consider individuals also eligible to apply for funding.
Okay, I'm really glad that somebody raised that question because my understanding of what you meant, Gordon's, please help me clarify this, was, I don't know, mom loses her son, needs money to bury them. Can she apply? Can an individual person that needs help with something related to opiate crisis apply? I relapse and I need to go to treatment. Can I apply to the Maine Recovery Council to get $1,500 to go to treatment?
Well, that would depend, in my opinion, entirely upon whether we have, a category of support that includes that type of support. Some states have done that. I mean, it kind of takes to its ultimate conclusion the fact that we're trying to help people in recovery and benefit individuals who have lost people to this epidemic. So again, I just think at this point, we may not choose to have such a program, but we certainly wouldn't at this point, I think, rule out individuals, whatever their needs might be.
Okay, so that helps clarify the individual section, and we've added 2 more kind of bullet points on my spreadsheet. What does everybody think at this point?
So I'm still kind of struggling with individual. The other terms
One at a
are very
time, one at a
clear.
time.
The other terms are very clear. So I don't, it's not a deal breaker for me. I like everything, but it feels a little more unclear than the other 5 categories. But it just might be me. It's not like I'm not gonna vote against it. I just am struggling with that floating word.
Okay, Miles, I saw you try to come off mute. I'm sorry for cutting you off. I'm just trying to run a tight ship here.
No, and this may help, Joe. Just an example for the individual piece. What if we decide as a council to fund some sort of workforce development grant, some scholarship grant, and we want individuals to apply for this scholarship grant? To me, that's kind of what comes to mind. So I wouldn't want to rule those out. And it's something that I'm working on as we speak. So that's another reason why, to me, the individuals would be necessary in that category in there.
Okay,
And Dr.
perfect. And then Keena, thank you for your note. I think that was helpful. That helped me. That's great. Again, I wouldn't vote against it. That's good clarification.
Thanks, Joe.
Wow, thank you.
I have a very cute puppy behind me that's playing with my shoes and broke my laptop today, so I apologize.
Oh, not so cute puppy.
Not so cute puppy. He bit my laptop screen and broke it today, which was very disappointing as a puppy mom. Okay, so I'm hearing consensus on that everything on the screen should be included in eligibility for the types of organizations or people. Am I correct? And do I have a motion?
So moved.
Do I have a second?
I second.
Haley, can you call the roll?
Yeah. Liz Blackwell Moore,
Yes.
Todd Brackett, Joe Everett,
Yes.
Pat Kimball,
Yes.
Bruce Nodden. He hasn't joined us, has he? Mausolette,
Yes.
Gordon Smith,
Yes.
Kina Thacker,
Yes.
Chassie Toole.
Yes.
All right, that's 7. Passes.
Perfect. Thank you so much, Haley.
Courtney, just so you know, you have a half an hour left.
Thank you, Pat. I hope
You're welcome.
that this has been helpful. We're on question 4 and we're moving along. Okay, where are we? All right, we start to get into a little bit more of the hairy questions as we move on. Okay, so oh, hi Bruce. Welcome to the party, Bruce. I think Bruce is in the room. He's raising his hand, or he's in the
He's coming in as a panelist.
okay.
Okay, did you get him? He said he's trying to get in.
I'll brief him real quick and then we'll jump into the next question.
Hello, yes, I'm here. Thank you.
Hey Bruce, have you been watching along for a while, or do you want to be briefed on what we're doing? Oh, you're on mute.
No, just keep going. Go.
Okay, perfect. Great. So the question that we're on right now is what type of applications or application are we making? One, are we making an application that is for all pillars? I do think we've decided that we're focusing on the pillars, so I'm not going to try to take us there. But one application for all pillars, treatment, recovery, harm reduction, and prevention, that is sent out at the same time. Sort of like the one that you saw from Mary last week. Option B is that we are making individual applications for each pillar, treatment, recovery, harm reduction, that are sent out at different times. And what I mean by that is, like, we would pick, this is an example, we would pick that we want to focus on the recovery application first. We would create the recovery application, we would send it out, then we would score and send out money. And then we would work on the next one and the next one and the next one. So we're working on one pillar at a time and getting money out for one pillar at a time for option B. Option 3 is that we're making 4 different applications for the 4 different pillars, but they're all sent out at the same time. Gordon, I see your hand.
Thank you. I feel pretty strongly that we could send them out at different times. I don't see why, we might have an urgent need in a meeting or two in a given area. And if we have the application ready, to hold that up even for a single meeting because we don't have the other 3 pillars applications done. I don't know why we do that. I mean, the needs are urgent and there's no reason to, in my opinion, have to send everything out at the same time.
Okay, so you would be more in favor of option C, where we're making individual applications for the different pillars and sending them out one at a time, over time.
Out at different times. I mean, I think I'm under B. I mean, individual applications sent out at
Oh, yes,
different
I'm sorry. Yes, you're right. You're correct. I apologize. That was just
Yep.
my incorrect facilitation.
Okay.
Ella and Mary, do you want to, I see Ella's hand up, and Mary, do you want to jump in too to help bring any context to the conversation before the council deliberates?
I just had a question about option B. So for each of those pillars, would each of those applications fully close and the money be distributed before the next one opens up?
That was my intention when I wrote option B.
Okay.
I don't know if that
I
is the
see.
intention of the council at this point.
Okay. Yeah, I think I will say that in terms of changing the applications to cater to each of the pillars, it shouldn't take too much time, to Gordon's point of switching gears to create each of those applications. And I think, and Mary might you might disagree, so feel free to jump in whenever, but I think that for administrative purposes, we just want to be cognizant of tracking the applications as they come in terms of what that would look like if we got all of them back at the same time, or what that would, and for tracking, or if we got all of them back on staggered timelines. I don't know which one would be preferred because I don't know the volume and none of us do, but it is something to keep in mind.
Thanks, Ella. And I want to hear from Mary next, and then Pat and Liz, I'll get to you. But the other kind of what I was going to say, Mary, is also, does it change what you're about to say to just add the context of we all just agreed to do a letter of intent prior to doing a full proposal? So just kind of adding that. What do you think about this?
I will continue to think, but my first reaction to that is a letter of intent doesn't really change the process from my standpoint too much. Again, especially if that comes after funding discussions happen. What I am thinking about with the separate grant applications and the timeline for that is we're doing all of this for the first time, and we're already working to get the first funding award out through the contracts. And then with the grant application, I just want to be cognizant of all the different timelines that are going on. And if, it could be difficult if we put out one application and then 3 months later we put out a different application. And if we have individuals at different points in that process, again, being a very small team, I just want to make sure we're not spreading ourselves too thin or trying to answer, questions about a recovery application while also trying to score a treatment application and that sort of thing.
So Mary, let me try to reflect this back to you. If the council was to pick B as currently being discussed, would you be more inclined as the staff member to feel comfortable doing it in blocks? Like if we sent out the recovery one, we would be sending out the letter of intent. We would be making decisions about who funds it. We would then be inviting those people. Then we would be funding them. And until that process is done, not open another process.
Yes. Yep.
Okay.
And that also for me too is again, we're learning as we go, and I would want to give us the time to revise our application process or our actual application if that's the feedback we receive from the first round versus having 4 grant applications we put out and then saying,
Okay.
oh shoot, yeah, we should
And
change something.
Ella, I saw you. Sorry. Just wanted to.
No, that's okay. I was just going to echo what Mary said. I think that's sort of what I was getting with the tracking, to something to keep in mind. Yes, I can say more later.
Okay. And Gordon, is that your understanding and intention when you say that you're in support of B, that you want to do one block at a time?
Yes, I think so.
Okay, thank you. Pat?
So, thank you, because most of mine was answered by Mary and Ella. My concern with this portion of it is workload. And when I first saw it, I thought, well, if we did it at different times, that works better for their workload. Because, we don't have unlimited staff. It may be something that we look into as this moves forward, but sort of taking one at a time, with blocks makes more sense to me. But my major concern was which way creates a workflow that's workable with limited staff.
Perfect. Thank you. And Liz, or were you all set?
All good.
Wait, I'm sorry. Are you trying to go?
No, I'm all good. Sounds good.
Oh, okay.
B
Okay.
sounds great.
Okay, so we've heard a lot in favor of B. Are there any other thought processes on this that want to advocate for A or C? No. Okay, I'm gonna check the chat. Okay. I think that opens, I did not put a subcategory on option B, but I do think it opens the question of which one's first. Which I don't know if, Mary, would you want to have that conversation now? if B is the answer, do you want to have an answer to which pillar is the first pillar in this present moment, or could it wait until next meeting?
I'd recommend we push that off until we talk about priorities under each.
Okay, great, thank you. If there is nobody that wants to speak in favor of a different option, do I have an emotion to take up B as our process?
I make a motion that we take B as our process as we move forward in the applications.
Perfect, thank you. Do I have a second?
I second.
Thank you. Haley, could you call the roll?
Yes. Liz Black, one more.
Yes.
Todd Brackett, Joe Everett,
Yes.
Pat Kimball,
Yes.
Bruce Nodden,
Abstain.
Miles
Yes.
Gordon Smith,
Yes.
Keena Thackrar,
Yes.
Chastity Toole.
Yes.
That's 7 in favor and 1 abstention. It passes.
Thank you. Okay, great. So I think this is the next big question. We have about 19 minutes. So we've decided that applications are the primary source. We've decided that people are going to submit a letter of intent, that we're going to focus on one of the pillars at a time, and that almost everybody is eligible to apply. So what do these letter of intent / application include for funding? The options on the table are that the application letter of intent process are open to organizations as previously defined, and they can apply to under one of the pillars for anything in the MOU document. The second option is that there will be particular funding opportunities under each pillar, such as, but not my opinion, recovery housing scholarships under recovery, detox beds under treatment, etc. If that is the will of this group, it opens a subcategory to have a conversation about what are the priorities for funding and how those priorities would be determined, which I don't think we have enough time to answer that question. So I would table that for a future meeting if we get to the subcategory there. Or C, that there will be suggested funding opportunities such as the one above, but organizations can apply for anything in the MOU document. Thoughts? Ella.
I just want to say to keep in mind as you all think about this question, in terms of evaluating, you'll want to keep in mind how many or what sorts of applications you'll get to evaluate. So I think that C might be the best of both worlds in that you have very specific priorities and requirements for or guidance for what people are looking for funding. But if anything innovative comes up, then you don't close the door on that. So that could be a way of sort of narrowing down what you have to evaluate, but also keeping the door open.
Perfect. Mary, is there anything else you would like to add from the staff perspective before the council deliberates?
No, none at this time.
Thank you. Liz?
While I totally understand what you're saying, Ella, and that does leave us that, I do think that we will get then all the applications that we would get if we left it open to anything. And I think there are ways for us to do smaller applications that leave the door open for larger things, or do innovation projects really specifically that we set aside separately and have them be judged as innovation projects or as small projects for the 16 counties, but also really get really clear. Like, I personally think it's our job to do some more coordination and connection between all that's getting funded. There's so much funding going out there, and it's so uncoordinated. And I feel like us adding to the not coordination isn't helping. I think we should try as hard as we can to add in a coordinated way. So we know what the state, so we have a better sense at this point than most people do about what is getting funded on this topic and who's doing what. And there will be interesting things that we get from the community. But at this point, like, I feel like having us get more specific about where we see really clear needs, and then coming up with cool ways to make sure we're getting innovation or doing small funds. But generally speaking, we do this specific funding under opportunities under each pillar with, like, sort of how we did the other part, with the caveat of having innovation funds or funds for small things. That would be my proposal.
So
Yeah, that
oh, go ahead, Ella, sorry.
that completely makes sense. In fact, the more specific the council can get in their priorities and what they're looking for, the easier it'll be for Mary and I to continue going forward. So that makes sense. Thank you.
So Liz, I think I hear you saying that you are in favor of option B. I guess I would reflect back to you. If option B, how do we do the I thing? So how do we prioritize? Do you have a process by which we prioritize? Do you have thoughts on that? I'm not trying to get us into what is the priority. I think that's a
Totally.
black hole that's not for today.
Well, I'd say I think we're in process on that. Mary and Ella have been trying to collect information from all of us through that spreadsheet around what all the priorities are and what's the evidence for those priorities. So I think they are moving us in that direction, that it'll come back to this group to look at for us to come with some priorities here at the grants committee to bring to the full council, is my understanding. And so I think we're moving in that direction with a good process. Is that, Mary and Ella, would you agree with that?
Yes, I that's exactly what we're trying to do. And also overlaying that with some of the research that Dr. Johnson did for us earlier might help guide that discussion too. So once we can gather everybody's priorities, we were planning on compiling in the spreadsheet and showing like a bigger presentation of where everyone was at and what that looks like collectively. So I think we're on good track for that.
Perfect. And I'm sorry, I'm not technically on the grant committee, so I don't get any of the emails. So is the intention for the entire council to go through that process in the April meeting, or what is
Yeah, the intention with it is to have the discussion at the April meeting, and I will send out right after this the spreadsheet for everybody to have. My biggest ask is that anyone who does want to fill this out, just respond by Friday. That way Elle and I can compile all the programs and strategies and make sure the evidence is robust enough and we have that time to really help support a discussion in April, which will happen with the full council. But I don't feel strongly that we need everybody's input on this initial kind of information gathering spreadsheet.
okay?
Does that make sense?
I think so. You don't need everyone's input by Friday?
I need all input that is going to, anyone who wants to give feedback on programs and strategies and specific notes about any of them needs to get back to me by Friday.
Okay, perfect. So I'm gonna table this subcategory until later if we determine B is the option, but everybody just know that the subcategory of what are the priorities Mary and Ella are working on, and we're gonna have a discussion about that at the April meeting. And if you want to be part of that discussion, please get your feedback to Mary by Friday at 5 p.m. Perfect, great. Joe.
So I agree with everything Liz said. My only question is, as the chair of the committee and listening or hearing from our colleagues, I think that I'm hearing members of the council wanting an open application process. So should we entertain having A and B?
Which would be C.
But is C really, I like the word open application process, and I don't see that in C. I like that language. So what I hear is open application would just be like, me has occasionally done an open application process. They have other foundations. So do we think C covers that, or was that your intention, Courtney? You guys wrote, or the team that prepared this?
Oh, I see what you're saying. Are you saying two different applications? Well, now I guess
just thinking of like I'm thinking of like the council, everything Liz said, we have priorities, we release specific sort of opportunities. Totally, that's where I land as well. I'm just asking, do we think the full council has asked for an open application process? In addition, well, and then I would just, Joe's adding, in addition to sort of what the specific funding opportunities. I'm just asking if we need both.
Okay, let me try to reflect this back to you. I think I hear you saying, and these are examples, these are not the numbers or the topics, but are you asking for an application to go out for recovery community centers that has $1 million, an application for detox centers that has $1 million, and then an application for an open call for $1 million?
I'm not yet. My question is, do we think the council has asked for that? Is my question.
Okay, I mean, I'm the facilitator, but yes, I've asked for that.
So then I think it's A and B. Is what I see this if I was at Maine Community Foundation, they would have something like A and B and C. So I'm just trying to make sure we're acting on the will of the full council.
Okay. Does anyone want to respond to Joe's thoughts, or I'm just gonna call on Pat?
So mine probably goes with Joe. So my problem is, and I have some little sleep deprivation, so maybe my brain. I'm struggling with picking one of these because I'm thinking, well, if we have small grants, you may have it more open. If you had a $2 million grant, you may say, no, this $2 million grant is for recovery housing. This $10,000 grant is an innovation thing, you know, and it's as long as it meets the MOU document or the priorities of the council. So that's where I'm struggling as to where to go with that, because I don't know if we've decided, are we going to have mini grants and big grants, those kinds of things. Because again, I think if it's a large sum of money, I think it needs to be specific. I think if it's a smaller pot of money, I think we if I think of some of the things that have come across our paths in our emails, some of them are pretty innovative, but they're small amounts of money. And so I'm struggling with picking one of these.
Okay.
And I'm usually not this decisive, and maybe I'm sleep deprived.
Yeah, I mean, I think I hear the same feeling around the virtual table. And I'm hearing you say you want all of these things, but in different ways for different projects and for different parts of the work. I'm just struggling. I'm trying to get clarity, but maybe this is just one of those topics that we don't have clarity at this present moment, and we can table it for a future discussion. But I'm gonna give it to Liz for now.
I guess I'm wondering, because in some ways I think I've been saying the same thing that Joe said, but just in a different way. And that, like, I think I would love for us to get really clear in the pillars what we would like to fund. And I think we can also have an application for that's a set aside of funds that is for some open things. And whether that's innovation funding, whether that's asking I'm worried about Mary and Ella's capacity for doing tiny grants. Having watched staff here deal with ARPA funds that are small, the large grants take the same amount of time as the small grants. And so I'm concerned about their time. And so I wonder if there's a way for us to say, hey, we would love to give out small grants, but maybe that small grants, we want to give that out through a foundation who already has a setup for giving out small grants. And they come up with a method for doing those small grants under all the things. Like, we can leave it way more open. Like, I actually would feel totally fine and great about that. But I think, like, the large pillars that we know we have priorities on, I would like us to do applications that are really clear about what we're looking for, and then have a set aside for some other things. So I guess I'm with Joe on the like, how do we offer up both of those things?
Okay, Ella, and then I'm gonna
Can I
try.
just comment? Sorry, Courtney. I totally agree with Liz, and I think Pat brought this to the group. I think having an external entity manage those, like a foundation, would be right up my alley. So I agree with totally Liz too. Sorry to cut you off, Ella.
Sorry, Joe. Thanks, Joe. Ella and then Bruce.
No, the external entity is an interesting idea that I think we could discuss more. I was just going to echo Liz's concern about our workload in terms of handling multiple streams of work with these pillar grants and the open grant. I think maybe for the specifically round 2 funding, maybe we should try one or the other first, and then have that be an option that we can add on as we feel more comfortable. But of course, that's up to you all.
Okay, thank you. I also just kind of reflecting back, I wonder if, because I keep hearing about this innovation and like making sure we get it to little organizations, is that its own pillar? Like, and that's kind of a broader conversation. I see, Pat, maybe that didn't settle well. Bruce?
I just want to support what Liz said. That's all.
Okay. So I don't know that there is a motion. I'm trying to like gather all of that up and figure out if there is a decision that we've made. If anyone has suggestions here, or if this is a to be continued ... and I can get through one of the smaller questions.
I could try, and then people could say if they don't agree with this. Can I try, do you think?
That would be very helpful. Thank you.
Okay, I would make a motion that we have specific funding opportunities under each pillar. And that we create a separate funding opportunity that is an open process.
Okay. Do I have a second?
I'll second that.
I should have been doing discussion the whole time. I'm not very good at roll.
Yeah, maybe we could have a discussion about.
Is there
on this
discussion
one.
on that?
Yeah, because I feel like I want to hear if I caught what people are thinking, because I'd rather us get this right.
Liz, do you mind repeating that? I'm sorry.
Yeah, I said to provide an application for specific funding opportunities under each pillar and a separate funding opportunity that has an open application process. Yeah, please go ahead.
I just think they're 5 pillars then. I guess like I think it's just easier. I don't know if I'm wrong, and I'm really looking for reflection back here.
So my idea of innovation would fall in one of the pillars. So if you've got so if you look at the pillars are what's in the MOU of spending funds. This is just my head. So it doesn't need its own pillar because it probably will fall within one of the pillars. You're not going to fund an ice cream shop with you, unless it, of course, supported people in recovery to sell ice cream. But again, so when I think innovation, I think somebody comes up with an idea that's within the 4 pillars, but isn't a detox program. Or, okay, I'll use an example. This woman sent me this idea. She wants to open a golf course, a recovery golf course, where she employs a golf course for all the recovery people working the golf course. I'm not saying that's a good, that's a bad one, but for me, the innovation just means it's something a little bit different. That it's some form of recovery, prevention, treatment.
Well, yeah, I agree.
Reduction.
I agree with
just
you.
a little different.
I agree with you, Pat.
Yeah.
Like it's got to be within the MOU document.
Yeah.
But I'm just wondering, does it make so because there's going to be a 5th application at some point. There now we've all just agreed that each of these different pillars are different applications, and we're also talking about having a 5th application for innovation broadly. Like, things that don't fall within all of our other priorities so that everybody has an opportunity, but a separate opportunity. So I guess I don't know, I just think of it as like a fifth pillar of this.
I think maybe it needs a definition. And then maybe it does need to be its own pillar. Maybe
Well,
it
I
needs a
think
definition of what innovation is.
But there's pillars. So there's prevention, harm reduction, treatment, recovery. Those are pillars. The fifth one is, but within those pillars, we're going to get clear on what we want to fund. The fifth one is open. It's open to people who want to apply. They could be applying for something that's in those 4 pillars, but it's not within our priorities. It's some other thing they want to apply for that is innovative or hasn't gotten funding, or they want to argue that it should be a priority and we didn't make it one. I think it's not a different pillar, Courtney. It's just that it's not within our priorities that we identified within the pillars. Does that make sense?
I think we're saying the same thing. I'm just thinking,
I
think I'm just thinking of it because now there's 5 applications.
There's
To me,
5.
there's 5 pillars, and pillars are just parts of applications that I don't know. It's not a big deal. But there's 5 the intention of your motion is that there are now 5 different applications, 4 of which are directly tied to the 4 traditional pillars of the recovery process.
With our priorities.
With the council's priorities, which are TBD at another meeting. And then there is a 5th application that is everything else that was in the MOU document that wasn't a priority of the council, but is an allowable expense and may or may not be approved. Is that the intention?
Yes, and we figure out how to do that 5th one. It might look different from the other ones. We might want to put it out to bid to a agency to do it for us. We might want to, that's still to be determined. But it is it's a more open process.
Oh, I love this consensus building. This is great.
Well,
This
just to
feels
sort of-
good to everybody.
Sort of butt in, but I will. I think it's, Courtney, like, to me, A is B. Number or letter A to me will be there will be, so you do what you're going where Liz went. A is the specific, B is the open. Liz, is that what you're, that sort of makes it the, but was that, I'm just also trying to make it simple for a motion.
It's hard to hear you, Joe. You're very echoey. Is everybody else having Joe on the echo? Okay. I think my motion, I think I said it. It was there's specific funding opportunities under each pillar with our priorities and also an open application.
Okay, Mary and Ella, I see your hands up, and I'm interested to hear what you have to say, and also to see if this is the trajectory that seems reasonable to you, as our phenomenal staff who are doing great work.
I'm gonna have more thoughts about it as I process it, but this is more of a comment than a question. But I think we just need to continue to keep in mind the timelines around all of this, especially if we have 4 pillars and then this 5th open-ended application. Not only the timeline of opening those applications up for the community, but also if we have a pillar application, does that exempt somebody from a community application? Or I guess I just want to be cognizant of that in the way that we discuss it, especially publicly once the decisions are made. Because if we do have more than one grant application happening, having established that workflow in advance is something that I feel strongly about to help the workload future on for us. So we're not getting lots of questions about 6 different grants.
That totally makes sense. And I just want to reflect back to the council that the decisions that this group has made today could mean that the treatment pillar doesn't open up for a year. Because I mean, at least 3 months per pillar at this point. And if you've got 5 pillars times 3 months, that's more than a year. So the decisions you are making are kicking the timeline for some parts of this work. And if that's a decision the council wants to make, that's okay. But just make it with realization that you're making it, I guess.
Correct. Or we recognize we have a workload and we partner with a community foundation to do
For
some of the
that.
work.
Or we hire more staff, like we decide we need to hire more staff, so they have
We
more
can do-
support. Like, I think there's lots of options for it, for
I
deciding.
can add another
that.
question to the 17-page question to how to fix that problem.
Yeah.
Ella, and then we are past time and wanted to just wrap this up with you all.
Can I?
I
Brendan wants
yeah.
to speak, but he's coming in over the phone. So I'm going to try to allow him to talk real quick. We'll see how it goes, if that's okay. He can't put his hand up because he's on the other side. Brendan, you should be able to unmute and talk.
There's some combination number that you have to press when you're on the phone. It's in the Zoom.
Oh, no.
6 usually.
*6.
Mm-hmm.
Are you able to unmute him, Haley,
Oh.
from your? Oh, there we go.
I can ask him to.
Hello?
You are, Brendan, we can hear you.
Yep.
Okay, but I also, am I interrupting what Ella was going to say?
No, you can go ahead.
Just briefly, and thank you. I just want to, just going back to Liz's construct, I just want to, as I've said before, to the extent that the council has an open application, keep in mind that, the application from what the council has identified as the need in Maine and where the need is in Maine, for work to be done. And, it's, as you probably all have experienced, in an open application, I would expect that the applications are going to reflect the investment that organizations put into grant writers and lobbyists and others to make them really stand out. One possibility for the council to consider is, if you are interested in doing an open application, that you narrow it a bit to focus on the Schedule A sort of priority items, at least in the short term. And, in the future, consider a broader selection of things. But that's one possibility. Thank you.
Thank you, Brendan. I think that that's a broader conversation than we can have in this present moment, because I would also offer that an open application process allows for the grassroots community to have access to funding that they've been disproportionately removed from broadly. So I think that 7 minutes over the meeting, we've made the decision on that part of the process, but we definitely should continue to have a conversation about what that actually means and what that looks like. Ella, did you have anything else?
I'll save it for next meeting, so that we can focus on it.
Okay, so I just want to reflect back what I think that we've all agreed on.
My motion's still on the table.
I was going to say, I have a motion on the table.
Yeah. can we
Sorry,
just
could
vote
you read
on
the
it?
motion, Haley?
That we have specific funding applications under each of the pillars, and we provide an open application. I think you said something about priorities that I missed. I was going to rewatch the video.
It's to have specific funding and opportunities under each pillar based on our priorities,
Okay, I'll let that part.
with a fifth one with an open application.
Okay.
That's the motion. Do I have a second?
Second.
That was a second by
Yeah.
Joe.
Pat
Haley.
seconded the first time.
Oh, Pat seconded the first time, so I already had a second on the table. I apologize. Haley, do you want to call the roll?
Yes, just give me 1 second. Liz Blackwell Moore,
Yes.
Todd Brackett, not here. Joe Everett,
Yes.
Courtney Gary Allen. Oh, sorry. Keep looking at you and then wanting to call you. Pat Kimball,
Yes.
Bruce Nodden,
Yes.
Miles Olet,
Yes.
Gordon Smith,
Yes.
Keena Thacker,
Yes.
Chastity Toole.
Yes.
That's 8 passes.
Great, thank you all so much. As a final recap for our conversation today, the grants committee made the following recommendations, which will be before the full committee for ratification, I guess. You chose that applications will be the primary way that people get access to people and organizations get access to this money, with the ability for the council to determine that that's not the process, but primarily that will be the process. You chose that organizations will submit a letter of intent. The grants committee will decide, score those letters of intent. We haven't figured out what scoring means, and then the council will ratify your decisions. You want to provide funding to entities including 501c3 nonprofits, C4, for-profits, individuals, public and private schools, and units of government, as well as there will be individual applications for each pillar: prevention, treatment, recovery, and harm reduction, with specific types of funding availability. And also there will be a 5th version of an application that is open to organizations based on the MOU document, with a more conversation waiting to happen about what MOU document means. That is how far we've gotten. I guess I just want to, I know we're over, but I guess, was that process helpful? Do you want to finish the rest of the questions at the next grant meeting? What are the next steps here? There's still.
Could we just quickly run down the agenda for next time? Was there any carryover from detox, Gordon, for next month or next?
No,
Or
we
past,
did
actually.
we did a full report on my detox, Joe, before you came on.
No, but is there anything, I'm just trying to, I know Haley's gonna need the agenda like in 5 minutes. So like, what is the agenda for next time? So obviously, go ahead, Pat.
So Joe, I will catch you up later about the detox. The next item that Mary and Ella are going to bring the priority list. So we know that will be on the next time, and then we can finish this exercise that we were just doing. But
Okay,
I think, because if Mary brings this document with the priorities and we look at it, it may make it easier for us to move forward with the questions. So, but Mary,
I think that actually might be close to perfect, because the next set of questions are about available funding, levels of funding, can an organization apply at the same time, etc. So I think that might be almost a perfect transition, because the priorities are going to influence the process moving forward.
And I don't know whether Brendan wants to bring, I don't know if it'll be ready, the contract before the committee for Piscataquis. So that may be something we discuss also. I don't know if he'll be ready at the next meeting to discuss that. So that's what I'll fill you in on the detox, the priorities, Piscataquis, and the exercise we did today.
The other one question I had was, my next question on the list is how much funding is available for each pillar. And then I had a sub, like, is this actually a finance committee question, or is it a grants committee question? Funding availability. I just don't know.
The funding availability really starts with the finance committee recommendation, I think.
Okay, so I am a member of the finance committee. So do you want me to bring what we've learned today to the finance committee to have this conversation to bring it back to you?
I think if you have the priorities, if we decide, I think you just bring the question to them. Once we finish this activity and we're able to say, sort of, because we can't totally say, but because the full council, once they have their priorities, then how much money do we have available, and how does it spread out, probably is a finance committee question.
Okay.
So you can say, I'm assuming you can say, we want to split it a third kind of thing, but they're going to tell you what that third is.
Yeah.
They know exactly how much money we have and we don't have to spend.
So would this committee make the decision of a third, or would the finance committee make that decision?
Probably the finance committee, based on our priorities. I'm assuming. I don't know. That's a tough question. That
I
lines with
wonder if it's a
me.
council.
Sorry, I'm
council
like such a
question.
process person.
Yeah,
I really struggle when I
really
don't
think
have
Feels a little bit
process,
like a
so.
council question.
I think Liz is right. It's a bigger question that says how the finance committee says you've got so and so dollars, you've got $10 million. It really is within the council to say, once they've made their priorities, once they've done this timeline, to say what money goes where. And I think Liz is right. I think that's a full council decision, with the finance committee telling you how much money you have to spend.
But we can keep going through your questions, Courtney, and because I think your questions are really great and get us thinking about these things, and then we can answer some of them and some we won't, and we'll have to bring them to the full
So the
council.
next process is we'll be back here in 2 weeks. We'll finish
Yeah.
the questions and see where we're at. Okay, great.
Exactly. I think it's been awesome. Thank you so much. I think we're getting so much, I feel like we're getting a lot of clarity. So thank you.
I feel way better. I just like really need direct communication and like understanding of what's happening, or I spiral out of control, which you have all seen on multiple occasions. So I just thank you all for doing this process with me.
Joe, are you going to send me the agenda for the next meeting?
Yes, I just sent that to you and I'll send it to you, Mary and Haley. So it's basically everything we just said, and I just put contracts on there, Brendan. And I always have their business because of the quick turnaround due to public notice. I know sometimes it seems like the agenda is a little all over the place because we have literally 5 minutes to turn around the meeting with the frequency of meetings. So I think we're good to go for next time.
Who's the baseball player that did that speech on the mound? That's what Joe sounds like. Joe, you're
Sounds so awesome, Joe. So awesome.
Joe DiMaggio.
Haley
Joe
and
DiMaggio,
Mary,
that was it. Thank you, Courtney.
Haley and Mary, I'm also going to send you my PowerPoint in case it's beneficial for the public to be able to have access to it.
Yeah, I put it with the meeting materials. I try to for everything we present on.
Okay, great.
All right.
Okay, bye. Thanks, everybody.
Thanks,
Everyone.
everyone.
Bye all.
Courtney, will I see you Friday?
Yes.
Cool. Sweet.
Did you